Bismillahirrahmanirrahim. Assalamu alaikum, everybody. It is so nice to see everybody coming in. And I know we have more people coming in, so I'm just gonna get started because I know MSA timing is definitely our call here. Bismillah. So, Allahumma inni as'aluka ilman nafi'a wa rizqan tayyiba wa amalan mutaqabbala. Oh Allah, we ask you for beneficial knowledge and good provisions and acceptable deeds, Ya Rabb. And may Allah subhanahu wa ta'ala allow what we learn here today to be a means of khair. Before we start, let's all renew our intentions. We know that we are just about to start Ramadan, and taking care of our health and our well-being is a big part of that. And seeking out treatment where we need it is one of our obligations as well. So let's all renew our intentions to be the best Muslims we can, bi'idhnillah. On that note, HCI has generously partnered with us, and we just want to give you a quick spiel about what they do. And essentially what HCI is Human Concern International. They are a very cool organization that has been doing incredible work all around the world, dealing with a lot of the disasters and the earthquakes, winter emergencies, dealing with with issues in Lebanon, helping out refugees in Rohingya, as well as providing relief in Palestine and doing projects to actually build cities in Syria. So that's a little bit about them for you. Definitely feel free to check them out. May Allah subhanahu wa ta'ala bless them immensely for making this possible. And without further ado, I'd love to introduce to you guys Dr. Nahla. She is a psychiatry resident in our home, Ontario. So I'll leave it off to you.
Okay, thanks so much. Assalamu alaikum, everybody. Just want to check everyone can hear me okay and see me okay. I will start sharing my screen now. So we'll get ready to go. I know that not everybody that's going to join us here yet. So hopefully the majority of us will hear the talk, but if there's anyone who has any questions afterwards, I might have missed some of the talk, they're welcome to ask those questions as well. So I'll start my screen share. Okay, so I'll introduce myself a little bit more briefly before we get started. So I am working in Ontario. I'm a second-year resident in psychiatry. My story is a little bit, I guess, important to add because I will talk a little bit about examples throughout my talk. I use myself as an example because I'm more than comfortable sharing my own experiences. But there are certainly people in the audience who can relate to what I'm going to talk about, and a lot of other stories that would correlate with what I'm talking about. But personally, I grew up in the Greater Toronto area. Ethnically, I'm Syrian. I'm obviously Muslim. And I studied medicine in Australia. So that point in my life, that trajectory in my life did, I think, mold me into somebody who had an interest in mental health because of my own experiences with mental health, my own experiences living far away, being a medical student on my own far away. All of that put together has made me really who I am today and made me, I think, more well equipped, honestly, to be a mental health professional myself. So that's why I mentioned my background. I'm also happy to answer questions about that if anyone is interested later on. The topic for today, though, is navigating emotions in a general sense. But I will also be talking about this idea of what is normal, what is adaptive, what is maladaptive, what are negative or positive emotions, how do we navigate both? And then I really do want to create that line between when we should start to worry. Like what are the signs that we really should be seeking maybe like higher levels of care or assessments or really talking to somebody about what's going on. And the reason is because as a psychiatry resident, I'm trained in the DSM. I'm trained in pathology, which is basically the fancy word for things that have gone wrong. Right? Physiology is how things go right. Pathology is how things go wrong. That's what psychiatry really is. But I don't want to just be stuck within that realm. I want to make sure we look at every other aspect of our mental health. It's kind of the spiel of what we're going to talk about. I'll move myself over to the side in case it covers anything. So I already talked about kind of the agenda, what is normal. I am a very intersectional person in a general sense. So you'll see me talk a lot about the intersectional nature of our behaviors, our thoughts, our emotions, why we are the way that we are. And then I want to define mental illness very clearly because I also want you all to know how we look at it. Like, how would a doctor look at things when you go see somebody? What are they going to be thinking about? How are they going to be assessing you? Looking inward, navigating emotions and your struggles. And then I hope we'll have a lot of time for Q&A because I know that that's the bulk of the learning is going to happen there, I think. So why this is important to talk about? I always say this to people that a lot of my job is talking to people who have literally never said certain things to somebody, whether it's because of shame or guilt or not thinking it's appropriate or not wanting to be a burden. And then they say it to me or they say it to another mental health professional, and we mirror back to them like, wow, that sounds really tough. Or, you know, I'm in awe that you have gone this long feeling this way or doing this thing or going through this thing. And they're just like, I thought it was normal. The number of times that I have heard patients say, I thought it was normal. And we tell them, you really do not have to live like that. You don't have to. There are other ways, like we can help you, we can support you. So this is a major part of why I do what I do, both in my day-to-day job, and why I'm online doing this kind of work as well. Because I do want to highlight to folks that you really don't have to just go through your whole life struggling and think that that's normal. And until you feel that mirror back to you, you won't know. You often won't know. And then alternatively, you know, can be told by people that you go to that when you say to them, look, I'm really struggling or things are tough or like, I don't know if this is wrong with me. And then they're just like, oh, that's fine. That's normal. And it's like, the, you know, going to that wrong person at the wrong time. It can really derail everything. And we also see that kind of nature of patients who come in and they're just like, well, every person I've ever talked to before said it was fine. So I never asked for help. And then here we are, you know, a decade later, and we're just like, whoa, we're really deep in it. You know, we need to really support you. So this is why what we're doing today is important. What is normal? I'm going to quote a lot of Gabor Mate. If any of you are familiar with him, he's a psychiatrist in Vancouver, and a couple other, I guess, people as well, but primarily him, because I love his work about this idea. And he did actually write a book called The Myth of Normal, which he recently released. The reason I want to mention this first is I want to set the stage of erasing what you thought about what healthy is, what normal is, what adaptive is, what, and I really hate this word, but we use it so much. The idea of being well-adjusted, a well-adjusted human. I genuinely hate that word, and I'll explain why. So is our definition of normal flawed? What we say is normal, is it toxic? What we define as normal, how can we say is normal for everybody when we live in a world that carries like so many different cultures, ethnicities, religions, backgrounds, finance levels, like socioeconomic status, housing status, work, you know, educational level. You know where I'm going with this. Like, how can we have one definition of normal or healthy? It's bizarre to me. Like, that doesn't make sense to me. And Gabor Mate has this quote of, these are natural consequences of an unnatural culture. The reason I'm defining this or setting the stage is that you might think it's normal for somebody to study, you know, like all night and pull several all-nighters in a row and then succeed on their exams and then get into this like really intense program and make a lot of money. But if you really dissect all that behavior, it's very, very unhealthy. And they're probably doing things that are not good for their bodies, and they're probably not mentally okay. And I'm not saying this in the general sense of everybody who does that, but we might look at that and be like, wow, they're so healthy. They're so adjusted. They're doing so well. But why is that our definition of normal? Why do we view normal that way? You know, similarly, like, you know, when you look at individuals who are of a background that is discriminated against in the country they live in, so like Black folks and people of color, women of color, what is our definition of normal for them, and why is it different than somebody else's? For example, like, why do we say that it's okay for them to accept certain behaviors, microaggressions, verbal aggression, blatant racism? We accept that as normal for them, but I personally do not think that that is normal, and that should not be normal within our culture. I could talk about this slide for 3 hours straight, but I'm not going to. I just want to set the stage that my definition of normal might not be yours, and I want to challenge that thinking for you before we get started. The reason this is also important as a practitioner myself is that the World Health Organizations has basically performed like a lot of research, which outlined that social determinants of health, which are all these things I talked about here, right? Your socioeconomic status, where you live, where you grew up, your poverty level, whether or not you lived in poverty, your parents' education level, your education level. It's a long list. Those account for at least 30 to 55% of your health outcomes. Personally, I would argue it's more than 50%, but they have to obviously include the overarching percentage. And this is major because what we're going to talk about today, these emotions that are really difficult to manage, our mental health in general, you cannot remove yourself from a system that is like horribly constructed. And that was not constructed with so many people in mind. So certain people will tend to suffer more than others within this system. And again, it makes us challenge our idea of what is normal, what is healthy. Another quote that I really love, it is no measure of health to be well adjusted to a profoundly sick society. So before we judge ourselves and call ourselves lazy, right, or call ourselves stupid, or all these other things that we call ourselves, before we start doing that, maybe we should start to consider that as a society, there are certain expectations, particularly within a capitalist society, there are certain expectations of individuals that are absolutely unhealthy and that absolutely contradict with what is good practices for your body, for your mind, etc. Okay, so I want to mention what myself as a psychiatry resident and what my colleagues do in psychiatry is that we've had to draw lines, right? So there are a lot of people that have issues with the DSM. I validate all those concerns. The DSM is the diagnostic, I can actually pull it up for you guys. It's a diagnostic statistical manual, which is the book that we use that has the criteria for all of our mental illnesses. So people have issues with this. I totally agree with them for the most part. But it's also necessary in a way because we have to create a line, right? We have to understand at what point are we going to be able to define certain constellations of symptoms and help treat those symptoms rather than just dismiss everybody as, being poor, right? Or growing up with a parent who had a substance use disorder or as houseless. We can't just dismiss those things, but we have to create a way. We can't just like dismiss people for those things. We have to understand what group of symptoms can we put together and say, okay, look, this is a disorder, and this is when we're going to start to treat that disorder. So the main questions we ask are you able to function? Are you able to maintain relationships? Are you so far from your baseline as an individual, baseline being like how you've been generally, like your whole life? So for example, a lot of patients will come into the hospital and not necessarily have awareness of how they are being right now, of their mental state right now. And their mother or father will be like, this is not my child. This is not them. This is not okay. Or this is not within their usual. This is so different than who they are. And that is a very clear, like alarm bell ringing for us that, okay, this is probably something that is bordering into a disorder. This isn't how they've always been. So yeah, we have to address systemic issues in the function part. But we also want to know, like if somebody's been working full time their whole life and functioning really well and suddenly they can't go to work, so it's a red flag. I do myself always incorporate like what is their job? Are they a woman? What kind of work do they have? What kind of work do they do? History of trauma and the burden of racism and discrimination. And then are you able to maintain relationships? I always have to say this because it's not just any relationships. We don't want people in toxic and abusive relationships. We want them in mutually beneficial, healthy relationships. So if you're able to maintain unhealthy ones, that's not a good thing. We don't want that for you. So we want to look at, okay, if they're having relationships, are they long-term? Are they healthy? Are they sustainable? And are they not contributing to their stressors and their mental state? They're actually helping them. They're protective. Because a lot of relationships can be destructive. So I actually just like took a picture of the criteria for major depressive disorder. I didn't realize it would be so small. I don't know if it's read like if you can read it. But what we do in psychiatry is break down diagnostic criteria. So you can see that there's a list of 9 criteria. You have to have 5 for a period of 2 weeks. So in summary, on the side of that slide is like the criteria include like time, your function level, relationships. I talked about baseline, all of that. But I want you guys to see the notes. And this is just some of the notes. There's like a lot of notes in our DSM. It's a very large book, obviously you can tell. That look at how much is there to rule out before we sit here and say for sure this person has a major depressive disorder. And this is one of the more, I guess, more commonly diagnosed disorders. And this is how much exclusion criteria there is. So if you can think about like more severe things like a schizophrenia or something else, how long that list would be. So, obviously we looked at bereavement, financial ruin, losses from a natural disaster. We're taking into account the determinants of health that would very much put someone into a quote, major depressive disorder, but it's a natural reaction to a very, very awful thing. I want to make sure that's very, very clear. I don't know if it's important for me to continue going through the kind of notes, but I just want you guys to know this information. Okay, so the talk is, we're going to definitely address emotions in a general sense, but I also want to make sure that I address that emotions don't stand alone, right? We don't just feel things and then nothing happens with that. Our emotions, they motivate our behaviors, they motivate our habits, our routines. They are what are at our core, the kind of the triggers for the way that we are, the things that we do, or the things that we don't do. So conventionally, there are definitions for good and bad emotions, right? Happiness versus anger, joy versus despair, the list goes on and on. I personally don't like distinguishing them that way. I personally don't think there are any negative emotions per se. I don't think there are bad emotions per se. And I'll use anger as an example. So just like how depression, in the diagnostic criteria of depression, you have to exclude the natural reaction to very awful things. You also have to understand that anger is a very natural response to very awful things. So in the example of adding intersections to somebody, the anger that a person of color, especially a woman of color, might feel in the workplace for the microaggressions that she may hear every single day, for the lack of credit she receives for the work that she does, for the hoops she has to jump through to have her work credited or even seen in a positive light, etc. This is just an example. The natural response to that continued, constant, chronic experience is anger. I don't see this as negative. And anger is also, it's an adaptive response that humans have too. It's not maladaptive, meaning that the way that we've defined anger is like, oh, it's not healthy. You shouldn't be angry. It's not a good thing to be angry. And I fully disagree with that, because without anger, we wouldn't feel motivated to change things, whether that's advocate for ourselves or protect ourselves or fight for certain justices, fight against injustices. Anger is a very, very important emotion. I would not define it as negative. And similarly, that goes for all the other emotions that we deem negative. And I wonder if we didn't see it as so negative, and if we saw it as something that was an adaptive response and an important fuel for change and for improvement, would we actually manage our emotions a bit better? Would we be better at feeling through these emotions? The reason I'm saying that is, if you think about it, like if you feel angry and you can identify, yeah, I'm peed off. I don't want to say any like bad words, but I'm mad. I'm furious. I just want to I want to do something. I'm feeling very, very upset. If you have all these emotions and you label them as very negative, and you feel then negative about yourself for having those emotions, how likely are you to feel through that and work through it and move on from it? What ends up happening is when we define these emotions as so negative, we feel things like shame and guilt for feeling them. We feel bad for being angry. It's bizarre to me. I don't know why we do that, but we feel bad. So of course, we're going to be more likely to like quickly swallow that emotion, get rid of it as quickly as possible. We don't want to feel bad. We don't want to feel shame. We don't want to feel guilt. So we'll pocket that away. We'll put it aside. We'll push it to the back of our mind. We won't want to address an emotion that makes us feel crappy. Why would we do that? So if we looked at these emotions and understood where they came from and actually allowed ourselves to feel them, we would be so much better at managing them. So the first step is acknowledging I am not a bad person for feeling angry. I am not bad, not inherently. Of course, if I punch somebody because I was angry, it's different, but we're talking about the emotion. So if I'm not a bad person for feeling this, but where is this coming from? And this takes a lot of work because I'll tell you, like myself, when I struggled a lot with the emotion of anger in particular. This is something that I struggled with a lot a couple of years ago. And I remember first feeling a lot of guilt and shame about it, but then I remembered embracing my anger. And I had to force myself to feel it, and I hated it. I hated the feeling of anger. I hated it. I hated letting it linger for even more than a few seconds. But I had to, because the fact that I wasn't letting it linger, the fact that I wasn't letting myself feel it manifested in ways that were even worse. It manifested in random outbursts at like the very wrong people or the very wrong thing because it was misdirected. My anger was being released towards, irritability towards other people. It was being released in ways where I would feel paralyzed and I would try to avoid any and all emotions. When it built up in my body so much, I became avoidant. I became, very kind of like a shell of myself. I avoided even feeling happy because I knew that I would eventually feel angry. So I didn't want to feel anything good. It manifests in ways that we might not recognize as related to this repressing of our emotions. But over time, when you repress so much, it manifests. It manifests in your body and in your mind, of course, in your mental health as well. So the first step is recognizing, why do I feel this way? Where did it come from? Why am I angry right now? And if you can recall the experience, if you can map back what was happening or why this particular time you were triggered or why this particular time you felt angry, you can work through that with yourself. The problem is when we're in a very dysregulated state, dysregulated meaning that we're really high or really low, it's hard for us to talk ourselves through it. And I'm going to talk about this later in the talk, is that we often need a mediator. So this is where therapy comes in. And of course, you knew I was going to say to you guys, all of us should be in therapy and that everyone should have therapy. I'm a proponent, but therapy doesn't always have to be a professional. Like I'll talk about that later, but I'll just use therapy in a sort of a overarching sense, is that it allows you the space to mediate. It gives you the space to reflect on where the anger came from. Where in your body does anger manifest? Where do you feel it? And if you can let yourself explain why you're angry, if you can talk about the source, you will find that the anger leaves your body. You will find yourself feeling better. Or you will find yourself letting the anger pass through you, but in the same time, thinking about how you would do this differently the next time this happens. How would you manage your emotions better the next time this happens? How will you understand yourself better? And instead of maybe like if your anger led you to doing something impulsive or something, unsafe for yourself or others, what will you do instead? So it can also go into like a sort of a behavioral plan, and changing your behaviors as well. But ultimately, we're not all capable of doing that on our own and being our own mirrors, which is why therapy allows you to go through that step of acknowledging, understanding, talking through it, and creating a plan moving forward. This is the bulk of our whole talk, so I hope that wasn't really fast, but we could definitely revisit this if anyone has questions. But I think the gist of it is, if we don't see things so negatively, we can allow ourselves to feel certain emotions and feel through them rather than suppress them. I was gonna go through this, but if we have time, maybe I'll come back to it. Okay. Oh, sorry. Okay, so another thing that I want to address, by the way, I don't know how much time we have. I think we're okay, right, for time? I want to address that if we're looking at emotions as not all good or all bad, right? We can see them in a gray zone and accept them for what, for just what they are, emotions. It can also help us ask the question of, why am I the way that I am? And that's kind of elaborating a bit on what I said earlier of like curiosity about why you feel this emotion. Where did it come from? Having introspection. So this is an important part of not just navigating your emotions, but like navigating yourself and working on the things that maybe you feel are not behaviors you might not even understand that you do, that you're like, I have no idea why I do that. And then you talk about it, or you explore it further, and you're curious about it, and you're like, oh, okay, like I get why I do that. So it allows you to question what happened to me, not what is wrong with me, because these emotions aren't inherently wrong. These thoughts are not inherently wrong. But it's the idea of what happened for me to feel them, what happened for me to think them. And then what drives your behavior is going to be that dialogue, right? That discussion of those, the answers to those questions are what drive your behavior. What's happened? So what happened in your life growing up or to this point has formulated your responses to people, to the world, to struggles, to difficulties, to challenges. It's literally formulated that. And it's not within our control. This is what happens to us, right? Growing up. So it's questioning those patterns and behaviors, and also acknowledging that maybe at a time in your life, that was good, that was healthy, that was adaptive. And maybe it's not so much anymore. Maybe those things are not helping me anymore. Maybe I need to look at those things and sort that out. So I love the quote of like, we find the answers to those questions in our history. There's probably a lot going on in everyone's life that's watching this right now, and in your loved ones' lives, or your friends' lives. There's a lot going on now, but you can't address everything right now without really understanding a bit of your history, a bit of your past. Oh, we have to let go of our patterns, not logo. And the way that I think a lot of psychologists, psychiatrists explain this is a compassionate inquiry. So again, it's not what's wrong with me, because that is a question, but it's not compassionate. It's judgmental. It's what happened to me, and genuinely being curious about that. And I've already kind of touched on what is causing me to live the way that I'm living, and why isn't it working for me anymore? Okay. So how do I look inward? So I kind of have like some categories here, but they kind of all intermingle. So we talked about active introspection. So active introspection can be like a moment to moment thing. So like you might feel, you might feel anger, and in the moment reflect like, oh, okay, I remember I saw this thing on this show and it made me really angry, or it reminded me of this thing. And you can go back in a moment, like in a minute or an hour, and dissect an emotion and an experience and a behavior. Or you can also do active introspection over a timeline. So over an experience. So for some people who have been through, a domestic violence situation, they can go through an active introspection of that process. Or a person who experienced like a particular bout of a panic attack or an anxiety attack, they can actively introspect, where did that start? Where did my anxiety or my panic begin? And consider kind of, the timeline of that presentation of that symptom. So active introspection doesn't have to be a particular length of time. It could even be your whole life. You can start active introspection from when you were, conscious and aware of your life. For most people, that's like, preteens or whatever. And and like you can think like, what did I learn about myself? What did I learn about the world? So in that experience, for example, if you're going to go back to like your childhood or your young adulthood, it's a very good thing to ask yourself, what did I learn about myself? How did I define myself as a result of the way that I grew up, or as a result of the way that I was raised, or the way that my dad spoke to me? What did I learn about myself? What did I learn about the world? And what did I learn about relationships? I'm going to move myself again. And what is my normal? And this is important because this is truly what shapes not just your worldview, but your capacity for understanding your own emotions and behaviors, and truly changing them, right? Because ultimately, we don't just want to be like, okay, yeah, there's no negative emotions. Okay, cool, we're going to scrap it. Thanks so much for your time. Like, that's it. We want to do something with this information. So, again, active introspection, generally, most people cannot do this on their own. You can't generally have the mental capacity to do the introspection and mediate the emotions that are going to come up and the thoughts. That's why someone there helping mirror back the emotions they're sensing in you and mirror back what you're saying to them, offer support, suggestions, and even allow you to pause when things are like really heavy or too much. So I really do encourage that this process occurs with somebody there helping you, not on your own. So this is the introspective understanding part, and then the patterns and behaviors. So I learned about myself that I'm lazy and I'm useless and I'm dumber than my siblings and I'm never going to be as successful as them. I'm never going to be as good as them. Based on what I learned, what have I learned to do to survive? So this is what I learned about myself growing up, or from this, this experience in my life. Now, basically all that I do and all that I've ever done is make sure that I succeed in school. And I will go to any length to make sure that I'm successful. I will make sure that I achieve the best grades and I graduate with the best grades and I get into the best program and I have the highest paying job. But in the process, I will do anything to do those things. And let's say I start to do substances to get me through that process. Let's say that I engage in very harmful behaviors. I don't take care of my body or my health. I develop an anxiety disorder. I now have panic attacks all the time. I've isolated myself from family, from friends, but at least I'm not dumb. At least I'm not less successful than my siblings. At least I'm worth something because I got an A on that test. So this is an example of, based on what I learned, this is what I've had to do to survive. And at a certain point, it is 100% not adaptive anymore. You are not doing okay anymore. Now you're anxious, you're depressed, you're isolated. Yes, you're successful in your school or your career, but this isn't how you have to live. And then your definition of what it means to thrive, what it means to be valuable, what it means to feel joy and happiness. If you speak to your friends, if you actually ask yourselves this question, you would realize that all of you have a different answer. And where does this come from? This comes from what we learned about others, about the world, and about ourselves. We talked about when does this all become maladaptive? So I just kind of mentioned that storyline of somebody who grew up hearing those things about themselves, how they've learned to adapt and I guess make themselves feel better. This is maladaptive, right? So somebody who's going to all these lengths to be something, to do something, to achieve this thing, it's not necessarily healthy, right? So to go to the length of the substance use, going through the anxiety, the panic, the depression, no proper self-care or physical or mental health, that it's become maladaptive, right? And there are better ways to feel valued, to feel worthy, than doing all of that. Ooh, sorry. And then this is a lifelong journey. So, you can't just like understand something about yourself and then like suddenly it changes, right? There's a time course for this. It takes time for you to, first of all, acknowledge it. For a lot of people, they're just like, no, there's nothing wrong. And I'm fine. I'm doing great, actually. I always hear that I'm doing great and I look great. Everything's fantastic. So sometimes it takes people time to really, really believe what's going on, especially if they don't come to the realization themselves, right? If somebody kind of like says to them, hey, like I noticed this and I wonder if you're doing okay, even in the most gentle way, someone can feel very defensive. And that's very natural, by the way. It happens all the time. As a mental health professional, I'm very familiar with it, but it does happen. That realization, that acceptance does happen. Then it takes time to feel the motivation and the desire to change. Because some people will say, well, I'm fine, like with the way I am. I don't really feel the need to change anything. Do I really have to? Again, it's their choice. You can't force somebody to change anything about themselves. And then once you come to the recognition that, yes, I do, then it's a process of unlearning a lot about your definitions of yourself, of the world, of what you're, of how to manage your emotions, of what healthy coping is, etc. There's no real end to this journey. It's kind of ongoing. And the last thing that I want you guys to take from this is that you're a project. That is not what the purpose of this talk is. I hope I've made it abundantly clear that like we live within a system that basically has caused a lot of or perpetuates a lot of mental struggles. So you could always look at yourself as like, oh, I'm constantly trying to make myself feel better within a system where I'm expected to work so many hours and break myself to the bone to be successful and to be financially independent and etc. But you can't actually feel better within that system because the problem isn't you. So you might get to a point where you're met with the systemic issues that are constantly perpetuating your feelings and your struggles. That doesn't mean that you're not in control of what your behaviors, and you're not in control of the amount of introspection you have and understanding of yourself, but that you're not a project per se. Like, we're all human beings. Okay. So for the practical advice, I mean, like we did talk about practically, the conversation of introspection and that active looking inward. There are other things that are actionable items that we can all do to help manage our emotions, help manage our behaviors, understand ourselves, and all of that. And obviously, I'm going to tell you that it's not just one modality. It's not just therapy, although I'm a huge fan. There's a lot to it. So biological, first of all, I'm going to split them up into different categories. We always want to make sure that before we start blaming ourselves for our mental health or, saying like, oh, I'm not doing so hot mentally, I must be ill or whatever, we need to look into medical issues. I know you're all in university right now, so you're all kind of younger age individuals. For the most part, many of you have not seen a doctor in a minute, like in a while. You probably don't know what your like labs look like, and that's fine because generally you're healthy. You don't need to go to a doctor as much. But when you do have these concerns, I really urge you to go to a family doctor or walk in or to your student health center if you have one, and just talk about how you're feeling and see if there's any need to rule out some medical conditions. So thyroid dysfunction is very common, deficiencies in your vitamin levels and in your iron, and even pain syndromes are very, very common to cause a lot of mental distress and emotional distress. So we need to address that first. And it can also be addressed even if you do have a comorbid mental health diagnosis as well. So we don't exclude them. It's just important to know it if it's there. And let's say you do have both, you can always seek both treatments at the same time. Now for the psychological side of things. So if you realize, look, I really want to talk to somebody about what's going on. I've been feeling XYZ. I don't think the way I'm living is going to be sustainable. Like, it's getting tough. I'm not able to manage. I want to talk to somebody. Talk therapy is a fantastic place to start. I don't want to include it in the main presentation because I think it's really, really lengthy, but I could even go through with you guys how to get a therapist if that's something that you're not sure of, because like we're all in Ontario, so I can help you with that. And what the therapy is a safe space for you, not just to share what you're feeling, but also talk about your goals. Like, for example, I know that there was a period in my life where I couldn't even tell my friends or my family like certain goals I had for myself because I felt like not like, and I love my family and my friends, but I felt like it would be like, I don't know, like either belittled or made fun of a little bit, or like, why would you want to do that? Like, what's the point of that? So having a safe space to talk to an objective person who will not make you like, who you don't have baggage with, right? Who will not make you feel silly or small, or even in the least say something that would like completely trigger you into feeling so bad about yourself. So it's meant to be a safe space. That's why an objective person that you don't know is usually more ideal than a friend or family member, because you then don't have to filter as much, or you shouldn't. Technically, you shouldn't filter. So that's therapy. And then, there's also other modalities as well. Like if you want to do, I think there's apps you can use that do like guided therapy sessions or virtual therapy. There's There's lots of books you can read as well. So psychological could also include like your own learning, books, reading online journals, etc. And then, yeah,
while we're at it, someone was asking, what are some practical steps to unlearn these habits you thought were normal? And I know you're talking about therapy as one. You want to elaborate more on that? That would be awesome.
Yeah, I mean, practical ways to unlearn habits. The best way to do that is cognitive behavioral therapy. I'm not sure if any of us are familiar with that, with CBT, but that's a type of psychotherapy that psychologists do and that psychiatrists do as well. The premise of CBT is that you kind of map out the origin of the behavior. So you don't start at the behavior, you start out, what was I feeling? What was I thinking? What did I do? And then how did I feel after? And then that behavior, like the what did I do, is the one that you're trying to address and trying to change. So it's first acknowledging the habit and the behavior itself. Usually you have to write it down like in a log. I think I could even pull one up for you guys if I find one. Maybe in the Q&A session, I'll pull one up. But you do it in a log. And then over the course of the CBT sessions that you have, you start to replace that habit and behavior with something different. And you have to consciously do it, which is why CBT is so great, because you meet like every single week with that therapist and go over your homework. So one week it might be like log your behavior, log the habit. Next week, okay, next time this happens, what are you going to do instead? So the next time it happens, you have to actively remember, instead of yelling at my mom or my dad, I decided in therapy that I am going to leave the conversation, exit the room. I'm going to tell them I just need to step out for a moment, and I'm going to, I don't know, write it down, call my friend. It could be so many different things, like whatever gives you a bit of calm. I'm going to listen to something. I'm going to go for a quick walk outside, or just step outside for some fresh air, like whatever you want to replace the habit with. And then you start to progressively, start to change that behavior. And there will be slip ups along the way, but the premise is that over time, you have to be very active in recognizing the origin of the behavior, which is the initial emotion that you felt or the trigger. Does that kind of make sense?
Yeah, that sounds pretty on point to me. Jazakallah khair.
But we can definitely talk about it in Q&A. I think I'm almost done, right? I'm almost done. We'll do Q&A in a second. Just really briefly, the social stuff is, the stuff that you have that are stressors, like financial stressors, work stressors, school stressors. So some of these things we cannot change. I've talked about already earlier, but whatever you can accommodate. If your job is completely depressing you and it is literally the worst part of your life, maybe we should consider like an alternative work. Obviously don't quit your job if you can't afford to, but like, let's start thinking about other options. For us here, what's important in our conversation will also include our culture, our ethnicity, our spiritual and religious practices. These are major, and these are huge parts of healing and feeling connected to others and feeling a community with others. And this is part of why we're even here today, right? This sense of community with one another. I'll just read this quote and then we'll finish. I'm sorry if I spoke really fast. I just didn't know how much time we had. Okay. So if you're thinking to yourself, like, why am I healing what isn't broken? It's not just about what's broken. Healing is a return to our wholeness. It's a reconnection with ourselves. Not everything that is faced can be healed, but nothing can be healed until it is faced. By the way, this is a quote from Gabor Mate, which he stole from James Baldwin. He just changed the words, and I want to make sure I credit James Baldwin. And that's it. Thank you so much. So we can do questions.
Awesome. Jazakallah khair. If you guys have any questions, definitely shoot them in. Allah subhanahu wa ta'ala bless you immensely, Dr. Nahla. I know there is a lot to doing.
I'm sorry. I feel like I spoke really fast, but I don't know how much time. I think it was an hour that I spoke, so I'm sorry if I spoke too fast.
Well, honestly, there's so many gems, and we will probably all be taking our time to digest it and to go through it. One of the questions we got was, how can I tell what I'm doing is more on the unhealthy side?
Yeah. Um, there's just so many ways that this could manifest. If what you're doing is inhibiting your capacity to be productive in your life, if people are observing that you're different, like people are commenting on your behavior, if you're finding it difficult to like do your day-to-day tasks, um, usually the measure is function, right? Is, are you able to continue functioning? If this behavior is inhibiting your capacity to function well, or to function reasonably well, then I'd probably ask for some help. Um, Sorry, what that means is like, if um, my like the fact that I stay awake, like I'm giving you an example, like I stay awake until like 3 a.m. every single night because I just want to like scroll on TikTok all night and it's what makes me happy. But I end up waking up so late for work. I'm rushing to get to work. I barely make it in time. I'm not focused at my job. Then I come home and I can't even like keep track of my household tasks, but I keep perpetuating this behavior and it's impacting my capacity to function. And now I'm frustrated with myself for doing it. You definitely should start asking for help.
Awesome. Jazakallah khair. Um, okay, another question. This is more on your role.
Yeah.
So someone's asking, what is the role of a psychiatrist and how's that different from a psychologist? A lot of times, like when people think of psychologists, they think of them being the ones that give therapy. So maybe like giving an outline of who can give therapy and what the roles differ between therapists, psychologists, and psychiatrists might be really helpful.
Sure. Do you want me to stop sharing so that we can like, maybe I'll stop sharing so we can like see each other? Is that okay? I mean, if you want to
Yes.
put your camera, but you don't have to, but at least you don't have to just like see a screen. Okay, so yeah, I love this question. So I'll start with the role of a psychiatrist. So psychiatrists are medical doctors that work within the specialty of psychiatry. So we do some elements of psychotherapy and psychological support, but primarily what a psychiatrist does is prescribe medication. We usually have patients on a medication for their mental health. So whether that's like an antidepressant, an anti-anxiety medication, antipsychotics, the list goes on and on. These are the medications that we prescribe. A lot of psychiatrists don't actually feel comfortable doing therapy. So I wouldn't assume that when you see a psychiatrist that they're going to be able to do any therapy with you. Because let me be honest, we're not very good at it. Like we're not good at it generally in a general sense, unless you actively want to be good at it and want to do it. So the role of therapists is major because they cannot and do not prescribe medication. But their role is to enact all these different therapies, like somatic therapies, trauma therapy, CBT, like cognitive behavioral therapy, dialectical, interpersonal. There's so many different modalities. They work with you through those different modalities of therapy. They're both very important. So research has shown that antidepressants on their own, you have like a good, little push up in your mood and your, behaviors and your capacity to function. But when you add therapy, like it's exponential. Like on their own, they're great, but when you put them together, the most benefit happens at that point. So when you combine the therapy and the medication, our patients do so well. That's kind of like how we work together and what our roles are. Does that make sense?
Yes. Jazakallah khair. On that note, someone is asking, do you think that struggling with your mental health makes it hard to be a therapist or a mental health worker? They have worries about being able to help others without impacting their own mental health.
Yeah. I can only speak for myself here in saying that I didn't take the decision lightly when I chose to, apply for psychiatry as my specialty, because I knew that could be an option, that it could be very difficult and then, essentially kind of make my mental health worse or impact my mental health. But I have to say, like, I don't think, okay, I'll rephrase that. So I think that psychiatrists and mental health professionals generally have a very good capacity for making room for very difficult and very traumatic things without them impacting their mental health, like without letting it affect them. They have a very good boundary for that, or they should. So yeah, there are certain experiences where sometimes we're just like, whoa, that was a lot. And it will be different for every professional. Like what affects me will be different than my colleague. But generally, you have to have really good boundaries. And if you're worried that it will affect you too much, or if you've gone into the practice and you've seen it and it's really been affecting you, honestly, I would consider speaking to a supervisor about it and seeing if you need support, but also consider that not everybody has to be a therapist, not everybody has to be a psychiatrist. And I really do feel like people are suited for that career and that job in a sense that they uphold very strict boundaries for what they're going to allow to impact them, what they're not going to allow to impact them. So I would say that's the first thing. But if your mental health is struggling for other reasons, like psychiatrists and therapists are not immune to their own struggles financially, socially, relationships rupturing, loss of a loved one, all of us go through things. That doesn't mean that I'm going to be, that doesn't mean that it's my job impacting me. It's my life, and it will definitely affect the way that I work. And that really does require you to be introspective and think, okay, I'm going through XYZ, like what should I do about work? And you have to be very, very proactive and think like, am I going to get support? Am I going to speak to my senior, my supervisor? Should I take a bit of time off, accommodated hours? Because then it starts to impact your job. And then patient safety is involved for sure. So those are kind of like the dual answers. Is like, if it's your own life impacting you, how to go about it. But if in general you feel like the work is going to be too much for you, whether or not you're in that kind of dysregulated state, I definitely would think about the job a bit more, because you really do have to have strict boundaries.
That's beautifully answered. SubhanAllah, it takes us on to the next question, which is how do I know what boundaries to set, and like how do I go about setting boundaries, and how do I know that these boundaries are even healthy, or if I'm just being selfish?
Yeah. So I'm going to turn up my brightness. Oh man, boundaries. Sorry, boundaries would be like a whole thing on its own. Okay, this is a lot. If without specific examples, how do I know when I need to set a boundary? When you feel like you're drained by a relationship, right? When you feel like you're seeing somebody, or you're, living in a house with somebody, let's just say in a general sense, family included, that it's draining. The relationship is draining you. It's not feeding you any capacity. It's not equal. It's not reciprocal. You need to start setting boundaries. So for a friend, it could be like that friend that always likes, that always makes you pay for their food or makes you drive them places and never reciprocates. And you're just like, I can't do this. Like, this is not feasible. Set a boundary. With your own family, if it's like, I'm just these are just examples, mother who relies on you for emotional support and comes to you and talks to you about other family members. And you're like, I'm not comfortable with this. This is not my burden to bear. I don't even know how to help you with this. Boundaries. Obviously in ethnic and cultural communities, it's very hard to set those boundaries because, it's your mother and you can't do that. But it's just an example. And how do you set boundaries? The first thing you should know is that a boundary is your way of maintaining the relationship, not ending it. Because in setting a boundary, you're just hoping and praying that the person will hear you, understand you, that changes will be made, and the relationship can become healthier and stronger. But a lot of people will view a boundary as a relationship ending, or as signs that things are not going right or they're bad. So I want to make sure we all agree, like we all acknowledge, when someone's setting a boundary with you, they want to preserve the relationship. They don't want to give up. They could easily just like not be your friend or your partner, or just like not engage with you and disconnect from you. So understanding that base thing is setting a boundary could involve a conversation of like, finding a good space, a good time for that person, like not just like throwing it off the cuff, and talking to them about this behavior that's hurt you, or this pattern of behavior that you don't feel comfortable with, and using a lot of I language, not a lot of you language. So I feel this way. and then telling them what you would like to happen. So, if this makes me feel that way, I would really appreciate if you don't do that anymore, or or if you ask me before you do this thing, or if we can have not talk about this thing. The boundary could sound like whatever you need. So that's how you would set it. And then how you kind of like go about the boundary after you've set it is literally just see how they react and how they respond. Like if they kind of don't want to be they kind of feel threatened by it, or they don't want to be your friend or in your life anymore, it kind of is usually an indication that that relationship might not have been healthy for you to begin with, and that they probably stood to gain from your lack of a boundary in the first place. So see how they react, observe if the changes happen. And at the end of the day, you have to set boundaries with yourself. So if you continue to be in those relationships, those friendships, that whatever, thing you're in, and accept that behavior, you got to tell yourself, I'm going to set a boundary with myself. I'm out. I'm not doing this anymore.
I absolutely love that. Okay. So someone was asking, what are some ways to see a mental health professional in Canada? Do I need to get a referral? Can I just reach out to them? As well as how do I even go about getting therapy or a diagnosis?
Yeah, in Canada, for the most part, because we're publicly funded, you have to get a referral from your family doctor to see a psychiatrist. If you know someone you want to see and they're accepting patients, you can actually ask to be referred to them, just like, a tidbit if you're interested. But yeah, you have to get referred, unfortunately. Another way you can see a psychiatrist is if you go to the emergency department. You can sometimes, like, let's say you don't have like a good family doctor, which unfortunately, like a lot of us don't have accessible family docs, or like they're not really receptive to our concerns. You could go to the emergency department and tell them what you're going through and ask to be referred to a psychiatrist from there, and you might get an outpatient appointment with them depending on which hospital you're in. But yeah, you have to be referred. And what was the other part of the question? Can you get a diagnosis?
Yeah, how do you go about getting therapy or a diagnosis?
Yes. Okay. So getting a diagnosis, you can actually get a diagnosis from a family doctor for most mental illnesses, honestly. There is a scope of what they know, and that's what they know. And things get, when we talk about the more serious mental illnesses, they don't really they can't really help you with those, but they would refer you at that point. But things like depression, anxiety, even like mania, bipolar, OCD, like they can diagnose all those things. So yeah, but if they can't kind of get to the bottom of it, you can definitely go be referred to a psychiatrist to help you. And then the question about therapy. So there's streams of therapy in Canada because we are publicly funded. You can access publicly funded programming like CBT, so cognitive behavioral therapy, and DBT and other things, but there's probably a long wait list. So if you're like in the Hamilton area, I'm pretty sure it would be very difficult to access publicly funded stuff like under OHIP. So if you can afford it, if you have insurance or whatever, oh wait, and actually wait, and so next thing is your students. So you could try to get referred to those programs from your family doctor to like the nearest psychiatric hospital's programming, and you could be put on a wait list for sure. But then you could also go to your student health center. They usually have free counseling because you're a student and you pay tuition, up to like 6 sessions usually. But correct me if I'm wrong, because I've never been to McMaster. I don't know. I've tried. I've tried to go to McMaster. I have been rejected both times. But I have no idea what their limit is. So definitely go to like the student health center, ask them what you're eligible for in terms of counseling. I also know that counselors at universities are not always great, especially at like intersectional, cultural, religious stuff, but it's worth a shot if you want to give it a go. But the ideal, best way is to find one on your own. And there's a website called Psychology Today. I can type it into the chat, where you literally put in your like location, like you can put your city, and then filter for whatever particular modality of therapy you want, the gender of the person, the religion, if they speak other languages, if you're more comfortable in a different language, you can filter for it. And then you get a list, and then you literally just call people yourself and just tell them, I'm looking for a therapist. These are my concerns. What can you help me with? How much do you charge? And you can be selective, because if you have insurance or if you are paying out of pocket, you obviously want to go with somebody you're comfortable with and you can afford. So be picky. Go through that list, call 3 or 4 people, and pick one that you're comfortable with, and that you actually want to see and that you can afford. And if it doesn't work out with them, find someone else. Like don't just accept what you get. Like be very picky, especially when it's private funding. Be very picky.
Yeah, and on that note, for anybody who doesn't know, if you do have a diagnosis, and you are registered with Student Accessibility Services, there's actually a fund called the BSWD,
Oh,
and they offer up to 2K in funds for counseling services. So that is available, as well as student wellness, like Dr. Nahla mentioned. Yeah.
so I
On
guess you could get the diagnosis from your family doctor, or even from the doctors at Student Health. I'm assuming there's family docs there, and then you could be referred to that program.
Yeah, as long as you have a diagnosis and you're registered, you can definitely apply. I would just be going through with your accessibility advisor from there, and just trying to have that inshallah approved.
Nice.
On that note, someone this question answered a lot of questions at once, so I'm just closing them at the same time. Someone was asking, what should I be considering to find a good fit for a mental health professional for me? So kind of like, what are those filters I put
Yeah.
on Psychology Today? And how do I know who to see, a psychiatrist, a counselor, or a therapist?
So counselors and therapists are basically the same thing. A therapist can have any educational background, obviously not any, but like there's like so many. They could be PhDs in psychology. They could have an undergrad in psychology with like some sort of master's in something. They can be masters in social work. They can have a particular degree in therapy. I don't know all their names. So there's so many different types of therapists, but I would group them together. Counselors and therapists are for me the same, but um, I don't know if that's not true. Um, but anyways, how do I know what filters there are? So, I mean, for myself and a lot of friends that are in my community, like I generally recommend that they have somebody that is from an ethnic background, um, because I know that our particular experiences might not. We might need to be explaining ourselves to someone who doesn't understand, you know, why our mom is the way that she is, or why I behave the way I do with my parents, or why or like even the way that we get married, you know, the way that marriage works. Like I don't want to have to explain that I don't date. I don't want to do that. So if you don't want to, you don't have to. There's no obligation for you to explain that dating. And I would also not want somebody to have to hear someone be like, you don't date. Like, no, there's no need for that nonsense. Like, I don't need that kind of reaction or response. So I always kind of suggest, like, if you want somebody who's from your same ethnic background, or you know, an ethnic background, maybe Muslim, like doesn't matter where they're from, but Muslim, and they would understand you. So filtering for religion, for culture, you can filter for gender. So some people don't feel comfortable speaking to the opposite gender. It's okay. No, that's okay. You can talk to somebody, you know, that's man or woman. Um, there's so many other things on Psychology Today that are more specific, like different modalities of therapy. So if you're someone who's been through trauma, you can always ask them if they do psychosomatic therapies like EMDR, which is the eye modulated therapy, tapping, like you could do tapping or butterfly tapping. Um, yeah. Oh, and also if you filter for religion, the person is probably more likely to incorporate faith into your treatment too, right? And understand that, like for you, prayer and Quran and remembrance of God, and like talking about God in your sessions is very important. And they might be more understanding of that, and have a back and forth with you versus someone who doesn't understand.
Yeah, it definitely helps a lot to have someone who understands you, especially when you're coming with like yourself and you're trying to be vulnerable and honest about what you've been going through. So it's definitely
Yeah.
good.
Yeah.
Someone else is asking, can family doctors prescribe medications for mental health issues? Or is it something you can only get after getting referred to a psychiatrist?
No, they can. So, fun fact, majority of mental illness is managed and treated by family doctors in Canada. Majority. There's a minority of them that are treated by psychiatrists. And the reason is that, first of all, we have way more family docs, right? We all know that there's way more family docs than psychiatrists. We have a shortage of psychiatrists, in fact. So if we were going to wait for the person to see a psychiatrist, they'd never get treated. So family docs have to have a very good understanding of mental illnesses and medications. But there are certain medications they would not typically prescribe on their own, like, ones that require a lot of frequent blood work. If for people with bipolar affective disorder, there are some doctors that are just like, no, I'm not touching that. I don't want to cause a manic episode or a depressive episode. I need them to see a psychiatrist. Certain mood stabilizers. There's a lot that goes into that decision of and then like substance use disorders. There's a lot that goes into the decision of saying, I can't do this on my own. I need a psychiatrist to see this person. But family docs definitely do. And if you're specifically talking about like antidepressants, anti-anxiety medications, certain mood stabilizers, sleep medications, family docs are great. And I think I missed the part about the question earlier about, should I see a psychologist or a psychiatrist? Unfortunately, because we're a publicly funded system, you don't necessarily decide if you're going to see a psychiatrist. You kind of like go to your family doc or go to the Emerge, and then you get consulted or whatever, and then they decide whether or not you warrant a referral or warrant follow-up with a psychiatrist. So what you do control is seeing a therapist. Unfortunately, you can ask for seeing a psychiatrist, but then kind of the system decides for you.
Yep, thank you for that one. There is a question on, just as a woman in your 20s, are there certain things that you should be more aware of in terms of your mental health, especially like from a biological point of view?
Okay. So I don't know if she's saying I'm in my 20s, because I'm not, but if she is, that's great.
I think she is.
Yeah, okay, she is. Not me. I've passed that stage.
Most of us, I think, are in our 20s.
Yeah, you guys would be. So I guess from a biological perspective, it would be the same things I mentioned earlier. So like thyroid conditions, pain conditions. Oh my goodness, like so many young women will have like undiagnosed endometriosis, PCOS, dysmenorrhea, which is basically like very painful menstrual periods. So many things contribute to a woman's mental health, because there are so many things that we experience that men don't, right? That men, organs that men don't have, and hormonal kind of changes that men don't have, although they have their own. It's not a strictly female thing or a woman thing. Men have a lot of hormonal imbalances and hormonal changes. But we obviously have the reproductive, or the kind of the childbearing stuff. And then additionally, like if you're a younger woman and thinking about getting pregnant or having a child, biologically you're more likely to experience a mental dysregulation or imbalance, right? Like after pregnancy, like postpartum depression and postpartum psychosis and so many things. Like we're just more likely to have these changes happen to us. So biologically, I would say there's a lot for you to consider, a lot for you to talk to a primary health care provider and rule out before labeling certain mental illnesses. Because again, like a lot of women I know have had very, very painful syndromes that were dismissed probably for years, and then they become very, very low in their mood, but they're not depressed, they're in pain.
Mm. Okay, so on the other side, we have two questions about like overcoming feelings of guilt. Whether it be feeling guilty for not getting enough sleep. We're all students, we're all going through a lot, and I'm sure some more than others. So like how do you deal with feelings of guilt for getting for just wanting to get enough sleep because you've got so much to take care of? Or if on the other hand, like this is kind of like dealing with yourself, what about if you're putting boundaries down or you're saying no to someone for marriage, or trying to put distance between friends, things like that. How do you navigate all of those heavy feelings at those
Yeah.
times?
Yeah, I think that's like such an important part of this period of your life, right? Because I feel people think like when you're in your teenage years, it's like an identity formation period. But I actually really think that your early 20s are the identity formation, genuinely. So when you're going through that process, you're creating new relationships, but you're also kind of realizing some of them are not so great or not so healthy or not so helpful, not so good, and distancing yourself. You're creating boundaries probably with people in your life that you've never done before, like family or friends, and you're just like for the first time speaking up for yourself as an adult. So it's a major part of your life right now. The guilt comes from somewhere though, right? Like the guilt comes from, for example, growing up thinking that your needs or your wants are not as important as somebody else's, or they're not important, period, right? So being told incessantly that, you know, to be quiet and stop talking whenever you said something to your parents, or to be told that it doesn't matter what you want, we're going to do what your dad wants anyways. It's, to be told that if you wanted to do a hobby or interest, that no one was going to make time for you or accommodate for you. So it wasn't done. When your wants and needs are not, first of all, like seen as valuable, and then second of all, not met, you're probably going to grow up thinking that to get a good night's sleep is like, you don't deserve it. It's not something you deserve to have. Or to have good and healthy friendships is like not even really something that is necessary, because like, you know, you probably don't even know if there are really good ones out there, because you might be so used to these very toxic or unhealthy ones, and you're just like, yeah, whatever. Like you have to accept it for what it is. The process of learning to put yourself first, the process of understanding and believing that you are valuable and you are worthwhile, and that your needs and wants are important, is the first step. You need to unlearn some of the things you were told and that you were made to believe about yourself. That's major. By the way, the example I gave about those things are not necessarily about this person or anyone. It's just allows you to think about examples in your life where you learn to believe that you didn't deserve to be well rested, Because I laugh about it because I know I believe that too. I believed it in my life as well, that like, who cares if I didn't sleep? Like it didn't matter. Nobody cared if I was tired. We still had to get on with the day. Who cares if I, got to, do the thing that I wanted on that activity or on that trip, because nobody ever even asked me or acknowledged it. We did what everybody else wanted, or what the adults wanted. I never got that chance. It's just an example, but think about where the guilt comes from. There's a lot of self-talk. Like you have to tell yourself, I deserve this. It's not bad for me to want healthy relationships. The guilt of losing friendships is a whole talk on its own, because I believe that friendships are much more formative to our lives than romantic relationships, in fact, and those ruptures are very painful. But you really do have to remind yourself and do the self-talk of like, even though this relationship once served me, and I once served that person, and we were good for each other, I can accept and believe that that's no longer the case. And I have to make this decision, and I have to close this door and make room for what's better for me. And also acknowledging that every time that you close a door, or every time that you end something that, even though it was very difficult to end and you felt guilty about, you make space for what's better. So really remind yourself that, like, kind of have that self dialogue with yourself. I feel like that was tangential. I'm sorry if I didn't answer the question, but let me know if I didn't. I can elaborate.
Yeah, honestly,
I'm sorry.
no, I felt like it covered it pretty well, but if anybody wants any points of clarification, please feel free
Yeah.
to
Yeah,
just let
please
us know.
comment. Can I
Yeah.
just address a comment? Someone said I have had a therapist ask me to consider to reconsider my position on dating. So super agree with the religious cultural background. Yeah, I am so glad you're here, because like to say that, because I'm not the only one that's experienced that, where someone's like, what? And then it's like the judgment, and it's just so unnecessary.
Definitely. Honestly, I've had a friend who had to go to therapy, and she was just explaining that she was fasting and the person thought she was starving herself. So it was a very
Oh
interesting
my God.
conversation.
That's like a whole misdiagnosis right there. Yeah. Like imagine being diagnosed with like a disorder for fasting.
Yes, Paula. Um, Someone else was asking, do you know of any support for pornography addictions?
Yeah. That's a really good question. Whoever asked that, thank you. Thank you for doing that because these touchy topics we can avoid and be nervous about, but it's good that we can talk about them. So the first person I would go to if you feel comfortable, because some of our family docs can be like a family friend or someone that we know. If you feel comfortable going to a family doc, talk to them. But if you don't, I would seek out, you know, some sort of mental health professional in your community, like locally, because they would know about resources in your local area. Because some people might see a therapist virtually in a different city. This specifically, I would say do it locally because there might be particular addictions counseling services, support communities, groups you can attend within your local area. So I would suggest you see someone locally. Unfortunately, if you don't have insurance, you'd have to pay out of pocket for that therapist to like connect you and to speak to them and have that support. There are a lot of individuals who even come to the emergency department with an addiction to something like pornography or with an addiction to gambling or buying like lottery max tickets or I don't know the correct name for it, but like those tickets. And we connect them to addiction services in their local area too. So you can even go to like an emergency department if you don't feel comfortable going to your primary healthcare provider. Because again, it just might not be someone you're comfortable saying it to, and that's fine. Within communities as well, there are addiction services you could like self-refer to. I don't know if you guys have CAMH in Hamilton, the Center for Addiction and Mental Health, or if you have like a local addiction services center that you can just literally walk in and be like, I want to book an appointment, I want to talk to somebody. I'm using the word addiction because just like any other substance or addiction, pornography is one of them. So it's not a pejorative term. It's not a negative term. It is what it is, right? It is an addiction, and we have to treat it as such. So, kind of the summary: family docs are usually first line. They can connect you to people within your local area. If you can't do that, that's fine. If you have private funding, get your own therapist. They'll connect you and they'll work through with you with that addiction. Those don't work. You can go to an emerge and they can advise you and support you and connect you. There's usually like the emerge docs have like a central referring process. They can refer you to psychiatry or they can just like give you the pamphlets and resources for addictions in the area. Or you can literally look it up yourself and say, okay, I live in Mississauga, Ontario, Addiction Services, Mississauga, Ontario. And you can often walk into those buildings and just say, I want to see somebody. I hope that helps. But if you guys know about addiction services in Hamilton, please mention it because I'm not familiar.
Yeah, if you guys even want to leave any anonymously, just write like addiction services dash whatever it is. If you want to send it even anonymously, I can post it, inshallah.
Yeah.
Yeah. Okay, so someone else is asking, what about guilt that comes with grief? How do you deal with that?
Okay. Oh, that's a whole thing. I don't know if we're gonna have time to talk about that.
That's okay. If you'd like,
Yeah.
we can also conclude on this note. We're gonna have a lot more, inshallah, to
Yeah.
unpack in the upcoming workshops as well.
I can try to briefly answer this one, but I think that this might be the last one we have time for. So it's up to you, right? Because we're at time.
Yes, go for it, inshallah.
Okay, I'll briefly talk about this, but I do 100% recommend that you definitely have someone like not me online to talk to, like a professional to talk to about this. Um, and grief counseling is so helpful too, by the way. Like it's just so helpful. But the guilt that comes with grief, when I think about that, I think about like the survivor guilt or the guilt of like not being in touch with that person as much or not, speaking to them as much or not telling them that you love them as much as you wanted to. Not being there if they were in the hospital as much. Like there's so many elements of the grief, of the guilt that comes with grief. I think like working through what is making you feel grief is major. Like, why am I, sorry, what's making you feel guilt? Sorry, is major. Like, what is the source of this guilt? Do I feel bad about X or about Y, about Z, about all of it? And how can you work through telling yourself that it's okay to feel that guilt? It's okay to feel bad about what you did or didn't do. It's okay to have missed out on what you wish you did for that person or what you wish was with that person. And to acknowledge that even, maybe there were things that you could have done better or you could have done more, like acknowledging your own flaws, acknowledging your own part to play in it. I don't want to like say to you like, oh, it's not your fault and you couldn't have changed anything, because sometimes that's not true. And sometimes we should acknowledge that and say like, you know what, I could have done XYZ.